Trauma, play, and epigenetics. Peter Levine, one of the world's foremost experts on somatic embodiment of trauma, he wrote this great book, Trauma and Memory, in which Besser van der Kolk added a foreword. So I'm going to take you through a little library of trauma and memory. Here, they make a strong case that says trauma can be resolved by reliving events in a hypnotic state, by safely replaying the old events in their minds and constructing an imaginary satisfactory conclusion. What Levine and van der Kolk in his foreword are saying is that a traumatic, unresolved experience will create an imprint on our brain that compels us to seek to repeat the experience, but from a position of control. He gives a good example. It's a cute example about the cheetah cubs that climb the tree to try and escape the lion's attack. Well, eventually the lion gets bored and goes away, but what do the cheetah cubs do? They play all day. They play lion attack. They're using play to help resolve the traumatic experience that they had when they were attacked. And in their play, they sort of work out new evasive maneuvers and ways that they might avoid successfully the lion in the future. This helps them resolve the trauma so that they have the memory of the experience, but not the negative emotions. Turns out Lawrence Cohen wrote a wonderful book called Playful Parenting, and he points out the same thing, that part of the point of the purpose of play for human children is what he calls emotional recovery. And he tells a nifty story about the little girl, the 3-year-old who goes to the doctor's office to get a shot. When she comes home, what does she want to do? She wants to play doctor. He says, but not from the position of the patient. She wants her parent to be the patient. And now the daughter administers the shot to the parent, or maybe a stuffed doll. And he says this response lets the child be in a more powerful position. It's a simple game, he says, of role reversal. Getting the shot made her feel powerless and reminded her of all the little frustrations she's had. It's traumatizing for a 3-year-old to go to the doctor's office. But when she plays doctor from a position of control and administers the shot, the emotional recovery, he says in the play, is quite real. The fantasy game that the child chooses helps resolve the feelings that she had. We do this all the time. We carry, unconsciously often, traumas from our childhood into our adult lives. And we seek in our relationships the people who would help us relive those traumas, but from a position of control. We call that relationship chemistry. Now we wind up in a power struggle with our loved ones, seeking to control them, resenting them for not resolving our trauma. And all of these books say this is imprinted on the brain. But there's something else. Experiences, and especially traumatic experiences, are also imprinted in our epigenome. So here is DNA. But DNA can be masked, coded with other chemicals. For example, DNA can be what's called methylated to turn genes on and off. And these genes may help program neurological responses. That is, our experiences modify the expression of our genes. You can't change the genome through experience, but you can turn the genes on or off, and traumatic experiences will do that. Not only that, but those genes that are turned on or off, the epigenome, they will be passed on to future generations by the parents. What that means is your epigenome, your genetic expression, might be predisposed by traumatic experiences your parents had. And Levine doesn't talk about this. Levine describes the molecules of memory as if they all existed in the brain. And they do, but they exist in more than the brain. They also exist in the epigenome, and children can be born programmed for responses, genetic responses that were adaptive for their grandparents, but perhaps maladaptive now, and not understand their behaviors, their automatic negative thoughts, their what we would call neurological disorders sometimes have an epigenetic component because they had no experience with the trauma themselves. So what are we going to do about it? We're going to go back to Bessel van der Kolk, and we're going to take a look at all of the modes of healing that he describes in his book, The Body Keeps the Score. Here, the thesis is that trauma is carried in your body. There's a somatic expression. And in particular, these scientists, they focus on the brain because that's what they study. But your traumatic adaptations to your epigenome might be with you from birth. So it's not just that you're not conscious of some experience that you had, it's that you never had the experience your parents did. You have the response. So what do? We need new experiences. In the back of Bessel's book, he talks about using theater, and improv theater in particular, which I think he was introduced to from his son, and how when we relive the traumatic experience, remember play? When we relive the traumatic experience in an improvisational theater setting, in which we enlist the cooperation of props and other actors, we can come to the more satisfactory outcome that Peter Levine and Bessel van der Kolk talk about in trauma and memory. When we do achieve that more satisfactory outcome, that resolution from a position of control in this theatrical setting, that's when the trauma becomes resolved and you no longer have the negative feelings associated with the memory.